Ava Simonson woke up late one night with a stomachache, vomiting, and back pain, so her mother took her to her local pediatrician. He thought she had gastroenteritis and sent her home with some medicine. 3 weeks later, she went back to the doctor to get her CBC rechecked and found out that it was completely abnormal. They sent her to the hospital to be further tested, and on her dad's 30th birthday, they found out that she had acute lymphoblastic leukemia.
Leukemia is the cancer of the blood that starts in the tissue where blood forms. In a person with leukemia, the bone marrow produces more white cells than it should, and the white blood cells lose their ability to fully mature. The underdeveloped white blood cells block the marrow and prevent the bone marrow from creating other cells like red blood cells, normal white blood cells, and platelets. These abnormal cells are leukemia cells. Unlike normal white cells, leukemia cells do not die when they should. There are four main types of leukemia: acute myeloid, acute lymphoblastic, chronic myeloid, and chronic lymphocytic. Acute myeloid affects the myeloid cells and grows quickly. Acute lymphoblastic affects the lymphoid cells and grows quickly. It is the most common type of cancer in children.
Leukemia can be detected by urine tests, blood tests, spinal tap, and a CBC check, but can only be 100% sure of a bone marrow biopsy.
Some common symptoms are feeling fatigue, pale skin, fever, loss of appetite, bruising, bleeding, weight loss, frequent infections, petechiae, which are tiny red spots, night sweats and swollen necks, groins, stomach, or throats. Symptoms may come at any time and are not always first to appear. There is no official known reason why leukemia develops, but there are some risk factors believed to cause leukemia that are both controllable and uncontrollable. Some controllables include diet, physical activity, and smoking. Uncontrollables include exposure to high amounts of radiation, family history of leukemia or any other cancer, human T-cell leukemia virus type 1, or better known as HTLV1, blood disorders, exposure to chemical benzenes, and previous treatments for chemotherapy sessions.
Treatment for leukemia varies on age, type of leukemia, and whether it is chronic or acute. Common types of treatment are chemotherapy that uses drugs to kill the cancer cells. Chemo can be given to cancer patients by mouth, through an IV, through a catheter, and into the cerebrospinal fluid. Radiation therapy that uses high-energy rays to attack the cancer cells. Chemotherapy with stem cell transplant that uses high doses of chemo and radiation to destroy the leukemia cells. Targeted therapy, which uses drugs to block the growth of leukemia cells. And biological therapy, an injection that slows down the growth of cancer cells.